What are the likely side effects from going through radiotherapy?
Every part of the body has its own side effects. Like the head and neck that we are treating, you'll find that with time the mouth will become dry, the throat, even swallowing, be a little bit tough. You find saliva, because of the salivary glands, so it will be a little bit thick or very dry. The patient will be feeling the mouth being dry.
He was afraid, but I'm going to be black, maybe I can't walk, but since he started, he's okay. So I think he's going to be okay.
On the second day of my radiotherapy is when I noticed that the appetite's gone completely, and all the time I'm nauseated.
There are other things through the radiation. My body it started changing. It's like umechoma. Sometimes even walking is also a problem, especially the parts which were maybe the radiation was being directed, because those are rays which are directed in your body. So what surprised me is like now losing my blood. It is not the way it used to be. And also now this vomiting, also my weight started. I started losing my weight, especially from now the third chemo. So my body it started changing. Sometimes I feel dizziness. Sometimes now I don't want to eat. But at least inside me deep, I was strong.
Another side effect is loss of appetite, which happens quite frequently. The patient will feel tired, especially during the day, during treatments. But the good thing with all those side effects can be managed with time. Though we tell the patients that there will be side effects, but if you find that the side effects are more than what you can handle, make sure that there's a clinic open all through. For the dry mouth, we tell the patient to carry a bottle of water so that when they feel that the mouth is dry, they just sip small sip, take a small sip.
He told me throughout the treatment, definitely there are those side effects, and maybe some effects may occur, others may not. So they were to prepare me psychologically if in the journey. I'll see now today my body is changing. I'll start maybe vomiting, and before I was not vomiting, maybe my hair will fall down, or maybe I'll lose some weight. At least it will not be a surprise, because it is some of the combination of the side effects.
We know cervical cancer is prevalent, prostate cancer is prevalent, and if they need radiation, it should be on the pelvic region. What are the side effects from radiating the pelvis or the pelvic region in either men or women? What are the common side effects that the patients going through this experience?
Mostly you find that they have diarrhea. The same way, the weakness. Some even lose appetite, and you find that they can, because the urethra can be affected, you find that there's frequent urination. Yeah, such things.
When we are radiating, like for example, I'm giving radio for the cervical cancer. What are the critical organs around there? This will include the bladder and the rectum. So we regulate the dose depending on the surrounding structures. And sometimes you find you are not able to administer adequate radiotherapy because of the surrounding normal structures, which will be affected by the radiation. So you have to really be careful when you are selecting the dose.
After they finished their sessions of radiotherapy, do these symptoms or do these side effects go away, or do there some that persist?
Because we have long-term effects and we have the short-term effects. What I'm telling you is short-term effects, they disappear. About the skin getting darkened, that one disappears immediately after. Maybe after a month or even, it depends with the individual. It disappears so fast. So most of the patients who come for review, they come when the skin is okay.
It is costly. It is not easy journey. It is not like these other diseases. Me, when these challenges came to my life, at least now I can understand how cancer patients go through. how they are supposed to be treated. Like you are supposed to give love if you are a caregiver. This is somebody who needs your help. This is somebody who needs your love. This is somebody who needs even finances support, because if it is money, maybe whatever you add, it goes off, there is nothing.
The cost is there. We have to, we are doing some fundraising outside there, and we hope all will be well.
What's the average cost of going through radiotherapy? I know it depends on the cycle, but like how much is it per cycle and what would a patient need?
So for radiotherapy, it costs, one session can cost from 2,000 to 10,000 Kenya shillings per session, depending on where you go, and obviously depending on the sophisticated software that people can add on. And as I told you, the more the electronics, the more the cost. But a basic radiation therapy with simple planning techniques, it's between 2,000 to 5,000 Kenya shillings. In a country with a population of 40 million, and the radiation oncologists are about 10, so we are not enough.
It's a multidisciplinary team. It doesn't just require the doctors. What other specialists are required, and are they adequate?
We actually, for administering radiation, you need the doctor, the radiation oncologist to prescribe. You need the physicist who is going to do the mathematics and the calculations and the planning. And you need the radiotherapist. The actual treatment is executed by the radiotherapist. So you find we still do not have enough radiotherapists, we don't have enough medical physicists. And like for radiotherapists, we actually have a training happening in the country. So at least that has solved a lot of problems. But for the medical physicists, we do not have a local training available for them, and they have to go overseas, and that costs money, and they need scholarships, and it's really been a difficult problem.
So what does a medical physicist do?
Medical physicist plays a great role in terms of safety to the patient, safety to the workers. In treatment planning, he's the man who respects the toxicities of normal organs when the patient is receiving treatment. He also advises the doctors and the patient on radiation.
When you say advises the doctors and the patients on radiation, what do you mean?
The doctors will always come with the clinical aspect of the patient, and the physicists bring the science of radiation. And this plan has to meet the two. A good plan has to meet the two things: the clinical component of the doctors and the radiation aspect of the physicist.
Earlier you told me that there are about 15 medical physicists in the country, out of whom 5 are actually qualified physicists.
Sure.
Why do we have so few physicists, yet there's such a high demand for radiation therapy in cancer?
I would say there are few because, first of all, very few physicists will like to do medicine. That is the first thing, and they fear radiation as well. And training, again, capacity in Kenya and Africa is a challenge. Globally, actually, physicists are very few. But Africa, being Africa, we always have the challenges in terms of training, and very few institutions are able to facilitate that. We do commissioning, acceptance, we do measure radiation to see that it meets a certain quality required for treatment. We also do calculations, and these are very important in terms of giving the patient dose. And so the doctor will be prescribing, and the physicist will do the treatment planning, calculations, and giving instructions to the therapist.
At the moment, we still have deficiencies in radiotherapy equipment. In fact, the majority of the radiotherapy is available in the private sector. In the government, we're just talking of Kenyatta National Hospital. Moi Teaching and Referral also have built the center, and they're waiting for machines. So you see, for the members of the public, you're only talking of Kenyatta National Hospital, and it's not enough. And as it is, even like Kenyatta, we need like 10 machines, and now we just have 3. So there's still a waiting list for the patients.
si kuona vibaya, ilikuwa tu vizuri kwa maana damu ilikuwa inaenda inatoka, lakini vile walianza kunifanyia radiotherapy, damu ikasimama mpaka saa hii. Sijaona damu tena.
Since 2015, after the treatment, I've been going for checkup and up to now, showing nothing. So I know cancer can be killed. I know.
Ninakula, nilikuwa sikuli. Hata kitu kama managu nilikuwa sikuli. Lakini siku hizi ninakula, niko na hamu ya kukula.
You know, some people, if they say that you have got cancer, they just decide that you are going to die. So, no, with me, I was there and I was telling God is there, treatment is there, so we shall decide and come for treatment.
At the end of your 33 sessions and at the end of your 6 cycles of chemotherapy, what are your expectations?
I expect to be fully cured, and free of cancer. That's my hope.
Cancer is not a death sentence, and the treatment of cancer is multidisciplinary. Cancer is a disease, just like any other disease, and people should treat it as that. Though it's a bad disease, especially when you come in late stages, but there's always hope. You can have surgery, you can go for chemotherapy, you can go for radiotherapy, or sometimes you may need all the 3 or more treatments. And some, even after they've gone through radio and chemo, they are told to go on maintenance treatment, like hormonal treatment. So you take tablets for 5 to 10 years. So it all varies. And cancer affects both children and adults. But in our country, we see more of the adult cancer than the children cancer. And when we break down the adult cancer, we see more women having cancer than the men. Actually, 60% of the cancers occur in women. And when we look at the age, majority of the cancers are occurring in people who are like 70 years and below. So it's affecting slightly younger population in Kenya compared to developed countries.
That is where we end this discussion on radiotherapy for cancer treatment and management. We have learned that radiotherapy is manageable. We've heard from the professionals that make managing cancer with radiotherapy a possibility. In our next episode, we'll look at chemotherapy, and I'll leave you with a sneak preview on what is coming up next in that episode. I've been your host, Dr. Mercy Korir.
I underwent chemo, and in 2017, around December, it recurred again. Around November, December, it recurred again. Colon cancer. Then 2017, it recurred again. So again, I started treatment, and then I was told colon cancer had gone, and I'm doing chemo for stomach cancer.
You might visit a hospital, you are told a certain drug is not available, go across the counter and get one, and maybe you're financially unstable.
There are a lot of misconceptions about chemotherapy. I've met patients who will tell me, Doc, I feared to come for chemotherapy because I was told it will burn my hand, and I'll feel so much pain and I'll not be able to sleep.